Just kind of get cozy in the room. And then the shock comes, and then you start to feel yourself kind of melt into the chair.
Just let your body relax. Let your mind relax first.
My visions are all with like little colors, things. Oh, that could be colored pink, and that could be colored red. And then it starts coming up, some of the things that have come up in my childhood, some of the things that I hadn't looked at, some of the things that would help me move on.
I'm better at these than anything related to fractions.
I had a very clear picture. I'm sitting in this cage, and all of these people were holding me up. And for me, that just was sort of in our weakest moments, there's always someone to lift you up, and it's okay to not be strong all the time.
Ketamine it's a synthesized drug. It's approved by the FDA for use in animals as an anesthesia back in 1962. And then around 1970, they approved it for use with humans, and it's been used for decades in emergency rooms as an anesthesia. Patients who had come in from suicide attempts, if they had ketamine as an anesthesia, months later they would find out their suicidality had dropped considerably. They've realized that ketamine seems to be really effective with depression at this point, and also with trauma. When people experience trauma, a lot of times the network in the brain of these neural connections start to atrophy. They even have MRI scans over time that demonstrate this. And so basically the brain is not working as efficiently. A lot of the pathways start to get closed off, and this stuff helps regrow that and open that up.
I was sober for 25 years. I was just loving life. I was a principal, loving school, loving kids, loving just everything. And until I got sick was when I got hooked on all the medications. They said I was doing too much, so they sent me to a psychiatrist who gave me, you name it, every 2 weeks. I'm not talking like 10 pills. I'm talking 30, 60. I didn't need that. And the reality was I was very, very physically sick, but they didn't look at it that way.
Can I get the Greek book, and then I'm gonna try and draw something with you maybe? One thing that I just couldn't get away from was the physiological sensations that you get in your body when you're really anxious, like a panic attack. You feel like you're gonna die. You feel like you can't breathe.
That anxiety, you're laying in bed and you've already walked through your entire day and you haven't even put your foot on the floor because your brain is constantly going all the time.
No talking. And more than anything else, it was me not wanting to take medication anymore because of the side effects, and find a way that I can perhaps dig into other areas of the psyche in a way that I haven't before.
Ketamine is a little bit different, that it's working on a glutamate transmitter. And what they're realizing with the glutamate through the research is that it basically keeps the neurocircuits locked open, and this creates what's called neurogenesis or neuroplasticity. It's really about accessing past memories and allowing neurogrowth in our brains, so our brains actually grow memory chains better.
What it's really helped with is trauma. It's reconnecting some of the things that I shouldn't have lost, and also it closes off the ones that need to be done with.
I feel like I've been unlocked. I'm also able to reach a calm place rather than an interaction that is reactive, especially in tense situations, which can happen a lot, especially with a partner or with a child. You know, it's easier for me to really listen, and responding with love and genuine curiosity for how can I be with you right now. I may not be able to solve this problem for you, but I can be here and support you. You are going to come in contact with parts of yourself that maybe you didn't know were there. And we're going to have moments where we're going to have to let go of something maybe we don't want to. But I realize that I do have the courage to make hard choices.
This is therapeutic work, and sometimes it's not always the most comfortable thing. What I do notice when they come out of it, there's a resilience, an ability to talk about that experience that's really reminiscent of people who have worked through traumas, at a point where they can talk about it in their rational mind and not be so overwhelmed by the emotional impact of it that they then have to repress it, that they can't even face it anymore. And that's significant. I mean, that's what we want as a goal in therapy, is for people to be able to face their histories and manage that. Because there are some contraindications, hypertension, difficulties with blood pressure, this might not be the treatment for you because of the health risks. If there's a history of schizophrenia or psychotic breaks in the family, then we're a little more reticent, and we're going to do a more thorough exploration, get to know the client better before we administer ketamine to them. And this is one of the differences between doing this therapeutically and street use of a drug. We're going to make sure that you have a safe environment, that you're going in with the intention of this being healing, because that's going to translate into what kind of experience you have, and whether this is an experience that you can tolerate or might be further traumatizing if you don't take these prior steps.